Welcome to another episode of What's the Difference podcast. I'm your host, Jackie Rosen. My co-host is Sarah Patel. She's here with me today.
Hi, guys.
And we have a special guest today, Mallory Whitmore, who is an advocate for formula feeding for babies. Now, the reason you might be wondering, why is this topic on What's the Difference podcast? Well, as a person with a disability, I had a very difficult time choosing to formula feed my daughter when she was born. I felt like I needed body autonomy immediately after the pregnancy was over because my body was exhausted. Being pregnant with a disability is very, very difficult, and I never wanted to breastfeed in the first place. However, I was kind of forced into it. And because of that, I spiraled into a little bit of postpartum depression and had horrible thoughts about myself and all that. And I didn't need this pressure. It's hard enough to recover from a pregnancy as it is, then add on a disability, and it makes it even harder. And Mallory is an advocate for choice, and that's why I wanted to bring her onto the podcast. So thank you for being here today.
Absolutely. Thank you so much for having me. It's such a privilege and a pleasure.
So tell us about yourself and why you became an advocate for formula feeding and for choice when it comes to feeding babies.
Absolutely. So as you mentioned, I'm Mallory Whitmore. I am the formula mom on Instagram and some other platforms, and I'm a certified infant feeding technician. And I had a similar experience to you after the birth of my daughter. I felt a ton of pressure from my medical team, from society, from trolls on the internet to breastfeed. And it just wasn't working for us for a variety of reasons that I'm sure I'll get into as we continue our discussion. And I knew that if I, as someone who, considers myself to be educated and intelligent, could not find good, high quality information about formula, how to choose a formula, how to formula feed successfully, how to navigate some of the digestive challenges that can come with formula, that there must not be a lot of high quality information out there. And so I decided to really fill that gap, to provide the information that parents need so that they feel supported and empowered to feed their baby however works best for them.
So Mallory, you've mentioned in some written posts about health issues leading up to the birth of your daughter. Can you tell us about those and how it impacted your pregnancy and birth experience?
Absolutely. So I have had chronic pelvic pain for probably 10 years now. And for a while, I didn't know if pregnancy was going to be possible for me. I didn't know if pregnancy was possible, if it was what that was going to mean. And it took until after the birth of my second son to actually get a diagnosis. Before that, I know, as you know, in the disability and chronic pain world, there's just a lot of getting the runaround from provider to provider trying to figure out what's going on. But eventually I was diagnosed with Ehlers-Danlos Syndrome, type 3 hypermobility type. And that has ended up explaining a lot of my symptoms. But basically what that means is that I have laxity in my joints, laxity in my connective tissues, which causes high muscle tone, increased muscle tension as the muscles try to compensate for those really unstable joints. And what that has meant in pregnancy is that I have a hypertonic pelvic floor. So those pelvic floor muscles are exceedingly tight to try to stabilize my pelvis, which was the cause of my pelvic pain pre-pregnancy, and then also was a big factor in deciding to have an elective C-section, just because we knew that my pelvic floor muscles do not function the way that they are supposed to function. Both in terms of strengthening and lengthening. So, and given that, I also felt like I had a fair bit of emotional trauma surrounding procedures and diagnostics with my pelvic floor, trying to figure out my pelvic pain for so many years. The idea of potentially creating more physical and emotional trauma via vaginal delivery just wasn't something that made sense physically or mentally, emotionally. So, it has been such a journey trying to navigate my chronic condition and the demands of pregnancy and postpartum, given that they're so intertwined in my case.
I can't believe how similar our stories are, because
Really?
I've had chronic pelvic pain for 9 years. I've talked about it on the podcast before. Diagnosed with a UTI that was really bad and went out of control back in 2012. Okay. Never been the same ever since. I also decided to yeah, I decided to go
Mhm.
for an elective C-section because they said that the trauma would probably be less if I had a
Mhm.
C-section than if I tried a vaginal delivery. And I am so glad I did, because
Mhm.
I can tell you right now, it was traumatic enough trying to carry a baby when you have
Mhm.
chronic bladder and vaginal pain. And then, imagining a
Mhm.
vaginal delivery was just terrifying to me. So I
Yeah,
also,
absolutely.
yeah, I totally get you there. So, what was the experience like when you were trying to breastfeed and pump for your daughter? And at what point
Mhm.
was there like a breakthrough and being like, okay, you know what? I don't have to do this.
Yeah. So my daughter was born early. I also had a complication with my placenta. So they ended up doing her C-section at 36 weeks, 5 days. So she was preterm, just slightly. And looking back, she was just not quite ready to be on the outside. She was very sleepy, had a really poor suck, poor muscle control with her mouth. And actually, we believe it now that she inherited my Ehlers-Danlos syndrome. So part of that was likely related to the muscle control issues there. But trying to breastfeed in the hospital was just a mess. She wouldn't latch. She wasn't coordinating her sucking appropriately. She was losing weight. By the time we were at day 3, she had lost 12% of her body weight. And we were like, this is not working. She is not thriving. I am not thriving. I already felt a weight of postpartum depression come on just from the sleep deprivation from trying to nurse every 2 hours and everything else. And so we decided to start supplementing with formula that third day. And she, I mean, sucked it down like she was starving, because she probably was.
Oh,
And then I continued to pump for until about 5 weeks. And I was like, this just isn't working. It was too difficult for me to try to manage the formula feeding, the trying to get her to latch, the pumping, washing all the pump parts, keeping track of when the milk was expressed and how long that's good for, and then when the formula was poured and how long that was good for. And I was just like, I don't think that this makes sense to try to continue. And it was challenging because, all you hear in the hospital and from your providers and from your child's pediatrician is breast is best, breast is best, breast is best. And there was absolutely a point early on where I felt like, gosh, my baby's not even 6 weeks old and I've already failed. Like I had one job, which is to give my baby the best, and I can't even do that. And it was really damaging, and it was really hard to overcome, when you're also recovering from a C-section, you're sleep deprived and you're trying to navigate this whole new role. To also be trying to work through those feelings of feeling insufficient, or feeling like you failed your baby, or feeling like you've let down your baby because of choosing formula. So that's really a big reason why I started my platform, was to try to help other parents who have found themselves in that sort of situation.
I just wanted to ask, can you kind of go through like some of the symptoms with the diagnosis that you
Mm-hmm.
got? Like, what are some of the symptoms that you're showing to led to the diagnosis?
Mm-hmm.
Fortunately, you got it
Sure.
after having your second child, correct?
Yeah. Absolutely. So the question was about what symptoms led to the diagnosis. So what actually ended up happening, I have an identical twin sister, and she has the same sort of symptoms. So we knew that there was likely something genetic at play.
Mm-hmm.
And we both have had relatively frequent dislocations, knee dislocations, hyoid bone in the neck, ankle dislocations as well. And so I started doing some research about what could be related to all of these dislocations, because I was like, this is not right. And that led me to this realm of connective tissue disorders, and there's plenty. And then after talking with my PCP, my primary care provider, they referred me to a geneticist. And so I met with the genetic counselor, and she did a variety of testing, blood work, as well as, different diagnostic measures that she was looking at just within my body and my symptoms. And I got diagnosed that way. And so it has been a journey, and it's been interesting to realize, to sort of look backwards at these symptoms that I've been having throughout my life and realize they're related. So now I can look back and see, like, okay, the fact that I roll my ankle once a month is related. The fact that I have chronic pelvic pain and back pain is related. The fact that I bruise more easily is related. the fact that even my body type, which is tall and lean, is related. And so it's been interesting to look back, even though those weren't the symptoms that led me to the diagnosis, the dislocations were, to be able to trace back all of these other things that I thought were just quirks. I'm like, no, they're actually all connected to this diagnosis that I now have.
Yeah, it's quite interesting when, when we are trying to find a diagnosis or something, and you don't realize that you're so interconnected within our body till you actually get the diagnosis, and you're like, oh wait, it all makes sense now. And because a lot of it can be misguided information or misdiagnosis, right? Because so many symptoms are similar to other diagnoses, and you don't always get the same response or the same outcome.
Absolutely. Yeah. And I also think it's common for women, especially, to have the experience of doctors brushing off their symptoms or telling them, that it's in their head, or that it's psychosomatic, or that they just need to exercise, or they just need to lose weight, or they just need to eat healthier, they just need to get more sleep. When in reality, a lot of us have very real symptoms that are related to very real diagnoses and complications that get missed sometimes, which is really unfortunate.
Yeah, for sure.
So how is the experience having your son different from when you had your daughter?
With my son, I decided to formula feed from the start. I knew that the breastfeeding experience I had with my daughter was a huge contributor to my postpartum depression. And I knew if I wanted to avoid postpartum depression, I needed to do as many things differently as possible with my son's postpartum season. So I decided to formula feed from the start, and that allowed me to do just so many things to keep myself in a healthy mental state. So it meant that my hormone levels went back to pre-pregnancy homeostasis much more quickly. It meant that I could sleep in longer shifts because my husband could take half the night feeds. It meant that I could get back to wearing the clothes that I wanted to wear. And that sounds so silly. And sometimes, people will comment on my Instagram and be like, you shouldn't choose formula because of what you want to wear. But if you have experience with depression, those they're almost like guideposts of normalcy in your life. And that was a big thing for me, to be able to be back into the clothes that felt comfortable, to have help, to be able to have babysitters, and to be able to take my older daughter out for lunch because I could leave formula and leave, my baby with a babysitter, which, is much more difficult to do if you're nursing or pumping. All of those things were a factor. I've also realized since my diagnosis that a lot of women with Ehlers-Danlos Syndrome struggle to nurse or breastfeed because we have extra elasticity in our nipples. That's one of the symptoms is elasticity in my skin. So my skin is much stretchier than the average person. And that makes it especially difficult to pump because it's impossible to get the right flange size. And so knowing that as well, I was like, okay, all of the factors have aligned where this is just the right choice for me. And I'm not sure that we'll have another child, but if we do, I would absolutely go straight to formula again, because between the reality of my physical body and the reality of what I need mentally after birth, breastfeeding and pumping is just not workable.
My experience was literally they wanted me to pump in the hospital, and I put the pump on once and I had a massive panic attack, and I told my husband I wanted to run away.
Yeah.
And I said, I cannot do this. And like the next time I had to pump, they told me it was every 3 hours. I was like, nope. I can't do it every 3 hours. I need my sleep. And so I had a massive panic attack. And what ended up happening is we ended up staying in the hospital for 5 days, and it was a whole series of things that led to that. But what ended up happening on that final day, a different lactation consultant came in, and I finally screamed, I don't want to breastfeed. And she was really kind and said, you know what? It's not for everybody. That's fine. Let's get you on this. But then once I got home, there was still the pressure I put on myself.
Yeah.
And so I kept not giving up, but my daughter was miserable on breast milk. So the times that I would breastfeed her, and I mean, as Sarah knows, I would constantly be messaging Sarah, and I'd be like, this isn't working. And Sarah would try to give me tips, and she tried to she was being supportive, but I was like, finally, you know what? No. And then finally when I woke up one morning and said to my husband, like, I want to end things, because I was so depressed.
Mhm.
And that's from breastfeeding once a day. And at that
Mhm.
point, I said, okay, let me stop breastfeeding. Let's see how things change.
Yeah.
48 hours later, I
Mhm.
felt like a new person.
Mhm. Absolutely. Just having that control back over your time, over your life, and also letting those hormones settle. And I think that's a big factor that I don't see a lot of people in lactation community talking about is the hormones. You obviously have this huge hormonal shift at the birth, but then you also have all these, all of your prolactin escalating and everything else. And so that's a big thing. And then I think also the providers that I have seen in labor and delivery, during pregnancy, OBs, everything else, they are not disability informed. They really don't seem to have any understanding of the realities of what it's like to live in a body that does not function the way that is optimal, or that, a typical body is supposed to function. And they definitely don't understand the idea of having to make choices about what you prioritize, that it's not an option to do everything. That sometimes, you have a limited amount of energy, you have a limited amount of capacity because of the demands your disability places on you. And that if you have to make a choice between doing, X or Y, that sometimes breastfeeding is what has to get cut. That there's just not enough energy or capacity in your body sometimes to continue to give that much of your body when your disability is already taking so much.
I wanted to ask, like, there's so much formulas out there to choose from. How did you choose the formula you did for your children? Was it like the first thing you saw on the shelf? Was it according to what was reasonably priced? I know everyone has a bit of a different approach to it. So I just wanted to know, how was it for you in choosing the formula for your children?
It's totally overwhelming. You are right. There are 50 different varieties of formula on the market. And I remember with my daughter, this was prior to becoming an infant feeding technician, prior to doing any real research, because of course I had intended to breastfeed like you're supposed to do. So I had no idea what I was doing. And I remember she was probably 9 days old, and I was just standing in the formula aisle crying, being like, what in the world do I do here? It can be very overwhelming. So for her, we started off with whatever formula they provided in the hospital on day 3. And I was like, well, I guess I should keep up with that. So we tried that for a few days at home. And then she started getting really, really fussy and gassy and miserable. And I was like, I don't think this is the right fit. And so then I went down the formula rabbit hole, as many parents do. I think we ended up trying like 7 different formulas, trying to find one that we felt good about, both in terms of ingredients and price and availability, but that also kept her happy. And so after finally settling on a formula, honestly, through trial and error with her, I was like, there has got to be a better way to do this, to understand what the different formulas offer and how they treat different symptoms, and how I can choose a formula that will work for my children, but that I also feel comfortable giving and feel good about giving in terms of ingredients that align with our priorities as a family, in the other ways that we eat. So that's when I went back and did my certification. I also worked for a formula company for a while as well, and just learned everything that I could about formula so that I could be a resource to other parents who want to choose. So now there are a lot of things that I know that you can consider when you're choosing a formula. Specifically, what is the size of the protein? What is the carb source? Does your baby need something that's hypoallergenic or lactose free? Or, if they're struggling with constipation, you might not want palm oil. There's all sorts of factors at play in terms of picking a formula that's going to be right for your baby. And I wish it was straightforward. I wish it was like, oh, well, the majority of babies will be fine using X or Y, but that's why there are 50 different ones, because there are a lot of babies with a lot of different needs.
Exactly. And you can get them in so many different forms, like the powder form,
Mm-hmm.
go already, where you just pop off the top and add the nipple on and give it to them. Like, there's just, like, I would think I would be so overwhelmed just trying to pick which one. And again, like you said, trial and error, because if it doesn't work for your child, then your child's going to be miserable. Therefore, then you're going to be miserable because you have an upset stomach, or they're gassy or something. So it's like, like you said, I wish there was a easier way or a more
Mhm.
straightforward way where we would be able to choose the right one for our children. But unfortunately, it's not like that.
Yeah. And it's unfortunate too that the places where parents typically go for support, whether that's, their labor and delivery nurse or their postpartum nurse at the hospital or their pediatrician, those folks generally are not super knowledgeable about formula, other than the fact that it exists and they can potentially encourage that use. But they're also biased by financial agreements that the health organization or the university or the hospital has with formula companies. So the hospital where I deliver will only provide Similac formula. And Similac formula is great for some babies, but other babies might need something that's partially hydrolyzed, and there's not a super great Similac option that's partially hydrolyzed. And so it can be really hard to find unbiased information about what formula to use. And the formula that your pediatrician or your hospital may recommend might not be what's actually going to be best for your baby. It might be what they have on hand because of a relationship that they have with the brand.
For sure. And I know somebody that I know that was giving their baby formula. They were giving them the Gentle Ease formula. And then the pediatrician said, oh, well, you shouldn't use that because potentially your child could end up being lactose intolerant.
Mm-hmm.
So, but, so it's like, it's all because I think they ended up getting that one because the other formula they tried was not really working for her. So they said, okay, let's try the Gentle Ease one. So it'll be easier on the stomach and, on digestion and all that. And then the pediatrician comes back and says this, and then they're like, okay, so
yeah. So what do we do? Yeah.
We don't want our child to be lactose intolerant.
Yeah, of course. No one wants that. And there's, and I hear things like that occasionally from folks that message me or email me. And generally speaking, that is not advice that I personally agree with, but in terms of the lactose intolerance. But yeah, parents get conflicting information from so many different sources about formula, and it's absolutely overwhelming to try to distill down what's high quality information and what is going to work for my child. It's difficult for sure.
Something that, that happened to me was when I was, trying to do a little bit of breastfeeding, and I actually called, we have in Ontario, we have Telehealth Ontario, which is, like a telehealth hotline. So I called Telehealth Ontario because they said that, that they do provide breastfeeding support. And I just was asking, my daughter's mostly formula fed. I want to breastfeed her once a day. Can you help me? Because she's not latching. She doesn't seem to like it. And their answer is basically to make formula unappealing by feeding it to her on a spoon. And I got off the phone in tears. I'm thinking, you're giving me advice to basically starve my child so that she latches on and breastfeeds. And I sat and cried and cried and cried and said, there's no way I am depriving my child. We did touch on it a bit already, but can you discuss some more issues that surround lactivism and why this can actually hurt women, especially those with disabilities? And how can lactation consultants, nurses, and doctors better support parents who want to choose which way to feed their kid?
Absolutely. So I think lactivism fundamentally assumes that everybody's body is going to work as it was biologically designed. And we know from the number of people that wear glasses, the number of people that use insulin, the number of people that are in wheelchairs or have mobility aids, that the body does not always work as it was, quote unquote, biologically designed to do. And when we assume and treat folks like their body will, we end up really hurting and creating shame and guilt around those folks whose body does not work like that, either mentally or physically. And so I think providers really do a disservice by, number one, making the assumption that somebody's body is going to work the way that it, quote unquote, should to produce breast milk. And they also do a disservice by making the assumption that that's what parents want to do with their bodies. I talk a little bit on my page sometimes about bodily autonomy and how we have this fundamental understanding in all other areas that to coerce somebody to do something with their body that they don't want to do is deeply unethical. we understand that on all other facets, but for whatever reason, this idea that we can coerce and pressure and manipulate women into using their bodies to breastfeed when they do not want to, that conversation is entirely missing. And so providers, I think, would do well to, number one, understand that not everybody is going to want to breastfeed, understand that not everybody can breastfeed, and to realize that being anti-formula puts those people who either don't want to or can't breastfeed in a position of being defensive and being distrustful almost immediately of the support that they're trying to provide. So I could talk forever about it. It's really tough, because you will always hear me say that I think breast milk is ideal nutrition for infants if it's workable, but that for a lot of folks, it's not workable. And so providing the support that folks need for whom breast milk is not a workable option is really necessary, and it's almost always lacking.
And while we're kind of on that topic, just to like about the what doesn't always work, there's also, people get shamed for having C-sections. And this, when I look, I kind of went down the Instagram rabbit hole, which is actually how I found you back in April, when I was very depressed and wasn't feeling an attachment to my daughter, and things were starting off really slow for me. And so, I was reading all the stuff about how, it made it sound like if you have a C-section, you failed, you didn't give birth, and that it wasn't a choice, and that, we're so sorry this happened. We know it wasn't your first choice. And that's really frustrating to me, because for me, if it hadn't been for my pelvic pain, it could have been my cardiac, my congenital heart defect that would have made me have to have a C-section. They said my heart was strong enough that it was my pelvic pain that decided it. But, for women with disabilities, having the option to have a C-section and to choose that option is, for some women, no, it might not be the best option. So I'm not saying everybody should go have a C-section.
Yeah, absolutely not.
I'm saying for some of us, that was the best option. And I can tell you, like 8 days after having my C-section, I was already feeling way better than I felt the entire pregnancy. And so, tell me more about that, and, and kind of how medical professionals can also advocate for choice when it comes to how you deliver your baby.
Yeah, it's definitely intertwined in this same sort of debate around the biological norm. There's this idea that the biological norm is what's best. So, the biological norm is vaginal birth. The biological norm is breastfeeding. The biological norm is also that, families have 8 children and that they die at age 40. And so, we've long ago in other areas gotten over the idea that what's best is what is biologically normal. I absolutely understand providers wanting to discourage C-sections because there's very real extra risk involved in a way that's different than breast milk versus formula. There are benefits to formula, but the benefits to formula are very marginal long-term. Whereas the risks associated with a C-section can be significantly greater than a vaginal birth. So I absolutely understand that providers don't want to encourage C-sections in a sort of willy-nilly way. However, ultimately, that risk assessment and what the patient is willing to risk needs to be the patient's decision, because again, it's their body. They need to have the autonomy to say, I understand the risk and this is a risk that I'm willing to take on. I think with both breastfeeding and elective C-sections, there is the default assumption that it's just a choice that a parent is making because it seems easier. When in reality, the folks that I've talked to who've chosen formula and or who've had an elective C-section, there are always additional factors at play. Laziness is what gets treated as the predominant factor, and it is pretty much never a factor. The problem is that both birth and breastfeeding are extremely vulnerable and extremely private sort of events. And so people aren't going to willingly offer up like, hey, I have elastic nipples. Hey, I have pelvic pain. And so there's this scenario where folks generally aren't super vocal about why they've made these selections. And so then people assume they've made these selections because they're lazy or they're selfish or whatever. And so I think generally just keeping in mind the fact that we do not know the reality of anyone's story.
Yep.
We do not know the reality of why someone may be making a choice that we feel like we personally wouldn't make. But that even though we don't know, even though we may not understand, we can still validate that that people are smart and the reasons why they make decisions are valid, even if we don't know or understand what they are.
Well, I mean, Sarah and I can kind of discuss, we've talked about how, there is this stigma around disability where people think, oh, you have a disability, so you get to lie around and watch TV all day. Lucky you. Or something like that, or you can be lazy, or you have an accessible parking permit, so you don't have to walk that far when you go to the grocery store. You just park in that spot. And that's, I think, this, like you mentioned with breastfeeding or with a C-section, is that you're seen as, oh, you're just lazy. And this is such a huge stigma with disabled people. And I mean, I think we all have experience with people thinking that, oh, we're just trying to get out of something. Or Sarah, I mean, you've talked about how people have thought, they didn't believe you, that you have low vision.
Yep.
And it's such a real thing, and it's horrible.
And I think society just goes through waves of promoting and not promoting C-section and breastfeeding, because I don't know, like my mom was saying back in the day, like when I was born in like the 90s, it was about formula. Not about breastfeeding. And when she had my youngest brother in 2003, like there was a bit of a age difference, all about the breast, not formula. And then I've also known people where automatically, they want to have a natural birth. And the doctor's like, well, at 5 months or 6 months pregnant, you're going to have a C-section because your baby looks too big. So they're already planting the seed for people to make this decision. And then now for a first time mom being pregnant, you're worried and anxious because you're like, oh my God, my baby's going to be too big. How am I going to have, and they're saying I need to have a C-section. So there are all these worries. So there's like, they're planting the seed. And then, you go into delivery and then they said, oh, okay, well, it's been 5 hours. You're not progressing. Let's just do a C-section. Yeah,
you're absolutely right. The conventional idea of what folks should do oscillates wildly. I mean, you're absolutely right that in the 80s and 90s, there was a huge swing towards formula feeding. I think in the 70s, even the initiation rates for breastfeeding were as low as 25%. Now they're 83%. 83% of families in the US initiate breastfeeding in the hospital. So there's been this huge pendulum swing, even in the last couple of decades, away from formula to breastfeeding. And I think truly what would benefit everybody is a really good, solid midpoint of, we're not going to push one thing or another. We're going to evaluate what the individual patient's goals are, what the individual family's realities are, both socially, biologically, physiologically, mentally, emotionally, all of that, and then support that family's goals based on what makes sense for them versus, everybody should have a natural birth, everybody should formula feed, everybody should breastfeed, everybody should have a C-section, which largely happens in Brazil and places like that. Like just more nuance is needed.
Yeah. And like, I don't know about in the US, but I know over here now, even if you decide to choose a midwife over a gynecologist, you're kind of being judged or stereotyped based on that too, because it's always been you have a gynecologist and you always go to the hospital. But like you said, like each family has their own goals, their own preferences, their own comfort. So if they want to have a midwife or if they want to have the experience of a home birth, and if that's what they choose, then they should be okay with that decision and be okay to speak about it and not feel criticized or judged or like, how could you have a midwife and not a OBG? You just think midwives are not actual certified doctors to deliver a baby versus OBG. So it's quite interesting how things are kind of taking a backwards turn in certain things.
Well, Sarah, the interesting thing is too, and I mean, our listeners and our viewers can correct me if I'm wrong, but if you have a disability and you're in a high-risk pregnancy program, you're not even allowed a midwife. You just have an OB. They will not give you a midwife. So if I wanted, everybody kept saying to me during my pregnancy, well, what's your midwife saying? What's your midwife saying? When I tell them about a symptom I was having, and I'd be like, I'm not allowed a midwife. I only have an OB, and he's impossible to reach because he looks after thousands of people with congenital heart defects at the same time. Did I see my OB during my pregnancy? I think twice. I saw the nurse because he had so many patients with disabilities, with other heart conditions, that I was considered one of the low risk, high risk people, and I was shoved to the bottom. So it's interesting that when you have a disability, you're not offered that much choice when you're having a baby. And
I find that very hard to comprehend, because from my understanding, at least with a midwife, you have more of a personal connection, and you get to know that person and answer all your questions throughout 9 months, and that'll be there for you even throughout the whole, delivery process. Versus, like you said, Jackie, like you only saw your, OBG like twice out of the 2 times, and that's not even a guarantee that he's going to be actually when delivering your baby if you were to go into, early labor.
And actually, I'll jump in here. That was an additional factor for why I chose an elective C-section, is I knew that my OB could be there performing the procedure, doing the C-section. And I was like, I have had enough complications, both, with the pregnancy and with my, disability and chronic pain. I have tried to talk to enough doctors in my life and explain to them what I need, what works for my body, what doesn't work for my body, and all of that. I was like, I don't want to risk that I have some random person at my delivery that doesn't know me, that doesn't know my medical history, and that I feel like I can't trust, because I have a lot of distrust for doctors after, trying to be diagnosed for 5 years. For sure. And so, that was a factor as well for me.
For sure. And I think I agree. Like I'm not a mom yet, but I plan on hopefully soon. But it's having, to explain my disability over and over again, just in the medical field, and just right now me seeing a lot of different doctors, it's quite exhausting, and no one understand or get it to the point where you kind of want them to get it. So it's like, when I think about, okay, when I potentially have a child, am I going to choose a midwife or OBG? And I would think that I would want to go with a midwife, because I could have that sit down conversation and we can both get to know each other, versus going into the doctor's office every so often for a 15-minute checkup, and then on the day of not even knowing if that doctor will be delivering my baby and knowing my accessibility needs at that time.
Yeah, absolutely. Yeah, absolutely.
Well, Mallory, thank you so much for joining us today. This has been really informative, and it's a great discussion. And what we're always trying to do here is, in addition to discussing invisible disabilities, visible disabilities, and all that, and the stigmas, and trying to advocate, we're also talking a lot about pregnancy with disability, because it's not something that people talk about much online. I remember my whole pregnancy trying to find stuff on disability, and I managed to find like one article on whattoexpect.com about what to do if you're pregnant and you use a wheelchair. And that was like, as far as they were concerned, the only disability that required an article. So I really appreciate that you're having this discussion, and that, and I'm so glad that you joined us today. Now, tell us just a little bit more about what you do and where we can find you.
I run an online educational platform at theformulamom.com. I'm on Instagram and TikTok at theformulamom. And I support parents who are interested in supplementing or exclusively formula feeding, everything from choosing a right formula to getting over some of the guilt and shame that parents sometimes feel, to formula feeding safely and successfully and with confidence. So I have a ton of resources, including a free formula guide. So if you're in that formula aisle and you're like, where do I start? I have a free formula guide you can download that it's my curated list of my favorite formulas by certain needs. So I would love to see you guys over there on my social channels, or to help you out if you need help.
Thank you so much. I definitely have learned a lot today, just in our discussion, even though I'm not a mom yet, but it's good to know. So I'm really glad to have this conversation.
And also, I do want to admit, Sarah is already a cat mom.
Okay, there you go.
So she does have a cat. So she's got her pre-child right now. So she's getting ready, and obviously everybody can follow her cat on Instagram as well, because you have his own Instagram account.
So, that's amazing.
All right. Well, thank you so much again for coming on the show. This has been amazing, and we will hopefully catch up with you again soon.
All right. That sounds great. Thank you so much for having me.
Okay, take care.